Hospital Kuala Lumpur has responded to claims on social media by doctors over an allegedly dire situation in the hospital. But responding to the issue of a patient who was being treated on the floor in the Emergency and Trauma Department, HKL Director Datuk Dr Heric Corray explained that the patient arrived unconscious, without a pulse and was not breathing. On Friday, doctors at HKL wrote on social media that the hospital's emergency department had insufficient beds to accommodate the increasing number of patients and that all of the hospital's 8 wards were full, and they were in need of ventilators and oxygen tanks. The medical practitioners posted images and described how CPR procedures were being carried out on the floor. This situation is allegedly not confined to HKL, with doctors claiming that Hospital Sungai Buloh and Hospital Tengku Ampuan Rahimah in Klang faced similar challenges. There are currently 66,958 active COVID-19 cases in the country, and daily new cases have consistently hovered between 5,000 and 7,000 over the past week, pushing medical frontliners and the health infrastructure to the brink. Addressing an image of another patient being treated while lying on the floor, Dr. Corray explained that it was an emergency case and the patient was suffering from seizures and at risk of falling out of a canvas bed. The utilization of hospital beds is currently on the rise following an increase in admissions of COVID-19 cases, and that most cases are at stage 4, says Dr. Corray. According to the Health Ministry, all individuals diagnosed as COVID-19 positive are categorized into 5 stages. In the first stage, patients are asymptomatic, while those in the second stage display mild symptoms but have no pneumonia. In the third, patients display symptoms and have pneumonia, while those in the fourth have symptoms, pneumonia and require supplemental oxygen. For those in the 5th stage, they are diagnosed as critically ill and need to be intubated as well as put on a ventilator. According to Dr. Corray, the supply of oxygen at the hospital, both piped and cylinder types, are still at adequate levels. Dr. Corray explained that the management of COVID-19 cases in HKL is supervised by the Central Region COVID-19 Unified Command Center, which manages all COVID-19 cases in Selangor and Kuala Lumpur. Dr. Corray also said that the bed utilization at the hospital is at a very high level.